People living with cognitive brain impairment like dementia must cope with this debilitating disease without any kind of curative treatment. How being centered on care reimagined ways to connect with and treat people living with dementia.
Dementia is one of the biggest healthcare challenges of our time. Currently, there are approximately 600,000 people living with dementia in Canada, and that number is expected to grow to 1 million by 2030. People living with dementia are at higher risk for developing worsening confusion when they come to hospital. This can lead to more cognitive decline that can heighten their levels of confusion and bring on consequent aggressive behaviors, slowing their recovery. Patients risk delaying discharge or requiring alternate levels of care. Our team in the acute care for the elderly unit are using the innovative butterfly approach to care for these patients, making us the first in the world to do this in an acute care setting. With the progression of dementia, patients lose their ability to understand facts and logic. However, their emotional brain or feeling brain is not affected till much later on in the disease. The butterfly approach leverages this area to engage with patients through their feelings. We know that people who have dementia interpret color 5 times lighter than an average person. The vivid colors do help in the context of orientating these patients. The atmosphere in the unit is designed in such a manner that it's a non-sterile hospital environment, but much more of a home-like atmosphere that diffuses people's anxieties. Knowing the patient's background before they had dementia helps to understand the whole person and their lived experiences. This gives staff insight to behaviors that may seem out of the ordinary. The unit is full of colorful activities that engage patients from a cognitive and sensory perspective. This includes interactive stations, games, puzzles, and books. Our clinical learnings show positive signs in the management of these individuals in an acute care hospital setting. We found that there was a lesser utilization of antipsychotics, a lower incidence of falls, and a reduction in behaviors driven by anxiety. We continue to gather data to inform and validate how we evolve our approach. We hope to change the mandate of how individuals with cognitive health issues are cared for around the world.
Dr. Saha and the team on the acute care for the elderly unit at Brampton Civic Hospital are revolutionizing dementia care, providing patients a better quality of life and a renewed connection with their families. The future of healthcare is looking more promising because of their innovative and compassionate approach. Sign up to show your support for the work of Ontario's doctors.